Alzheimer's is the most common form of dementia, accounting for more than 80% of all cases. So next, Dr. Dean Hartley is going to explain to us what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
And lastly, we will hear from Ruth Drew, who is the Director of Information and Support Services at the Alzheimer's Association, and she will discuss the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
As Ruth said, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association, as a leader in this area, developed this list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. Now, this list is intended to be a tool to help identify unusual changes in person's memory, thinking, or behavior. It is important to note that this list does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced. Individuals may experience one or more of these signs in different degrees. So we're going to explore each sign and what some typical age-related changes may be. So first, our first sign is memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly relying on memory aids or leaning on others for things or tasks once handled on their own. A typical age-related change is sometimes forgetting information but remembering later. Our second sign is challenges in planning or solving problems. Now, some people may experience new difficulties in executive functioning, including developing or following a plan, or difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances. We're going to hear from John here, who is living with dementia with Lewy bodies, about how he experienced this early warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was a really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and not, there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
And sign number 3 is difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game. Conversely, a typical age-related change would be occasionally needing help to use a microwave or a remote. This could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. I can share just a personal experience here with my late husband, Art, who would easily get confused in the early stage with the difference between a cordless telephone and the remote control. And he would try to use them interchangeably, which of course would result in failure. So that's just a quick example of how something was noticed by me that sort of I passed over at first, but then when it became a pattern, I realized there was something else going on. Let's hear a little more about this from our association expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
What Ruth Drew just described was also something I saw in Art, in that I was still working, but he was retired at that time. And so the responsibility for paying household bills rested with him. And I realized we were beginning to get late notices on bills, which was very unusual. We were very punctual and organized in how we maintained that. But I observed Art one day going through the mail, and most of it was ending up in the shredder, including bills. So he was having difficulty with just common tasks, not recognizing the difference between a valid piece of mail and junk mail. Our next sign is confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it's not currently happening, or become confused about where they are or how they got there. This can become more dramatic or profound in the middle and late stages of the disease. Now, a more typical age-related change that we all experience could be getting confused about what day it is or when a scheduled appointment is, but being able to figure it out later. Sign number 5 is trouble understanding visual images and spatial relationships. Some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distance and determining color and contrast, which can all impact driving or navigating the environment around them. Now, vision changes such as cataracts are a more typical age-related change. This sign does show us that these changes are not just about memory. It's important to think about all the other ways that someone's daily life may be impacted by any of these changes. Our expert explains more. Let's take a look.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Number 6, new problems with words in speaking or writing. Individuals may have trouble following or joining a conversation. They may stop in the middle of a conversation and forget what they were talking about and continuously repeat themselves. They might also struggle with finding the right word or calling things by the wrong name. They may start using more descriptive terms to talk about something rather than the name of the actual item. For example, something like a mirror on the wall, they might not be able to grab the word mirror, so they use a descriptive term like the glass on the wall, or a wristwatch becomes an arm clock, or a clock on the arm, something like that, because they can't pull the word out, so they move to the next description that comes to their mind. Now, a normal age-related change would be occasionally having trouble finding the right word. We've all experienced that, but we get over it quickly, and it's not a repeated thing. So we're going to hear now from Phil, who is living with Alzheimer's, about this particular warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Our 7th sign, misplacing things and losing the ability to retrace steps. This sign often causes concern in people. I want to clarify that this is not about just losing your keys on occasion. Misplacing things from time to time, but retracing steps to find them is a normal age-related change. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen or identify the location where it was placed. Or he or she may put things in unusual places, such as putting a pair of shoes in the refrigerator. Because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing, and do so more frequently over time. Let's hear from Ruth Drew again to explain this sign further.
So some people wonder if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is, for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Sign number 8, decreased or poor judgment. Individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. This can be especially common in individuals who live alone. Making a bad decision once in a while, such as forgetting to get an oil change, is a more typical age-related change. We're going to hear now from Teresa.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually look like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Whoop, I went too far again. Let me get back here. Our ninth sign is withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagements at times. However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow a conversation. And as a result, they begin withdrawing from social encounters or hobbies. They may lose the confidence to engage in that way. We're going to hear from Dr. Soloway again about this.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
From my personal experience, again, this was one of the more difficult things for me to adjust to, because art became much more withdrawn from social engagements. When I had to decline invitations to get together with our social friends, our friends began to back off a little bit. So it became kind of a double, they didn't want to pressure us into doing things because they knew art was uncomfortable, and the more art got uncomfortable, the less we were able to engage. So it affected me as much as it did him. So it's not an uncommon situation. And our 10th sign is changes in mood or personality. Individuals with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious. They might get easily upset, either at home or when out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and becoming upset or irritable if our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed. I know that happened very quickly with my mom when she developed dementia. My mother was a really sweet, kind person, never had a bad word or an argument with anybody. She was just a very kind person. But after developing dementia, her personality switched rather dramatically to someone who would lash out at people for no reason at all. And it was just so uncharacteristic, very, very upsetting to witness something like that. But it's not, again, uncommon, because this is part of a brain disease. Dr. Soloway is going to share a little more here.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So let's check in with the Garcias again. As we talked about earlier, Mary's daughters are concerned about the changes they're observing in their mom. They want to know when it's time to see a doctor about the changes they've witnessed. So let's take a look at their conversation. Did you look at the warning signs I sent? I did, but still don't know. Mom's showing a couple signs, not all the time. How do we know if it's serious enough to see a doctor? Well, let's check with Dr. Soloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
So Dr. Soloway has given us a great recap. It's important to remember that these warning signs are intended to be a guide to help identify problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. Now, individuals may experience one, all, or some of these signs in varying degrees and in numerous or single occurrences. They do not have to experience them all for there to be concern. It's important to discuss any changes in memory, thinking, or behavior in either yourself or someone else with a doctor. Okay, I'm going to break here if there are any questions on what we've covered so far before we move on to the next module here, the importance of early detection. So I'll stop here for a second. If you have any questions, you can enter them in the chat or whichever way you're comfortable.
I was just going to say, sorry for interrupting. We do have one question in the chat, and thank you everyone for putting your questions in the chat if you have them. So this question is, in the beginning, how can you tell the difference between dementia and Alzheimer's, and do they progress differently?
If you, I think you're referring to the differences in Alzheimer's versus other forms of dementia. If that's what your question is, dementia, think of dementia like you might think of, this is an analogy that works for me. You might think of soup, but within the category soup, there's chicken noodle, there's vegetable, there's barley beef, and so forth. Dementia is that umbrella term for the different kinds of diseases that occur, which can include things like Huntington's and Parkinson's and of course, Lewy body dementia, frontal lobe, temporal frontal lobe dementia that we reviewed in one of the earlier slides. But Alzheimer's clearly is the most common type of dementia, accounting for about 80% of all dementia cases, and the one that we're most familiar with. If your question has more to do with the differences between or how do you know if it's dementia versus something else, the best answer to that is to get an early diagnosis, which we're going to talk about here in a minute. But also, I think what you notice in patterns versus an occasional event can help you decide whether it's something to be concerned about. It's something that is out of character for the person or out of their normal behavior. I hope that answers your question.
I hope so too, and if not, I'd encourage the person who asked it to just put something, a follow-up clarification in the chat. Okay. So at this point, there aren't any other questions, but before we go on, Jean, I forgot to mention at the beginning, so I'd like to just insert it now. If everyone would be willing to put their first last the first name, last name, and zip code in the chat, that would be very helpful. The Alzheimer's Association gets a lot of grant funding and to support these programs, to educate us all about Alzheimer's and what we can do to prevent it and how to recognize it. And they have a reporting fund. So if you'd be willing to put your first name, last name, and zip code in the chat, that's all that's needed to record that they made a meaningful presentation in our region. So thank you so much. Really appreciate it. And I will see you again when we break again for more questions. So thanks, Jean.
Thank you, Shireen. Okay, so now we're going to move on to our topic of early detection. It is key that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging, as well as that of others around us. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. Many times, friends and family are the first to notice changes in someone's memory, behavior, or abilities. In this module, we will discuss why it's critical to address any observed changes early and seek answers from a medical professional. Sometimes the person exhibiting symptoms isn't aware or may not have the insight to know that they are experiencing changes, which is why having outside perspective is critical. This is especially important for individuals who live alone or who may be far from family and friends. Let's listen as Dr. Soloway discusses this and then hear from a care partner who was the first to notice changes in her husband.
You know, it's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, you know, if they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, you know, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to him or her about what you've noticed. This can be a difficult or uncomfortable conversation to have. The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive. Let's take a look. So first, we start by assessing the situation. What changes in memory, thinking, or behavior do you see? What is the person doing or not doing that's causing concern? Then what else is going on? Various conditions can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes, such as stress, diabetes, or change in medication? Learn about the signs and the benefits of early diagnosis. You're already taking the very important first step by joining us for this program to learn about these topics. Do you notice any of these signs in the person you're concerned about? Has anyone else noticed the changes you've observed? Talk with friends and family. What, if any, changes have they noticed? Perhaps they've already rung in on that based on a conversation they had with the person. Next, prepare to have a conversation. Who should be the one to discuss concerns with the person? It could be you, a trusted family member or friend, or a combination. It's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed, but use what you know about the person to judge what approach might work best. I can remember something that my family did with my mom and dad when my mom was exhibiting these signs and my dad was really frustrated, not knowing what was going on. We had a family meeting. We all gathered in their home to have a conversation about this. And I think, I know that I wish I had had this information before that meeting because it really was not successful. I think exactly what it says is my mom and dad both felt a little bit ganged up on by 5 kids who were all trying to give them advice on what we should do. So you have to assess that for yourself if you're going to have a conversation with the person, what style of meeting would work best. When and where should the conversation be held? It's important to have the conversation as soon as possible. In addition to identifying a date and time, you should also consider where the person will feel most comfortable. What will you or the person having the conversation say? You may want to build out somewhat of a script. Consider the following questions, and you can fill in the blank here about whatever change you're noticing. But for example, I've noticed that you're shredding good mail in the shredder. I'm concerned. Have you noticed that you're doing this? Are you worried about it? You might ask, how have you been feeling lately? You haven't seemed like yourself. Or, I noticed you don't want to drive the car anymore, and that kind of worried me. Has anything else like that been occurring? So you develop your own set of questions based on what you're observing. Offer to go with the person to the doctor. Ask the person to see a doctor and offer to accompany them. Try using encouraging words, such as, there are lots of things that could be causing this. Let's see if the doctor can help us figure out what's going on. Or the sooner we know what's causing these problems, the sooner we can address it. Or I think it would give us both peace of mind if we talk to a doctor. If needed, have multiple conversations. Don't be discouraged if the first conversation is not as successful as you'd hoped. Write down notes about how it went so that you can prepare for any future conversations. And don't dismiss the changes you're noticing simply because the person is reluctant to address them or the conversation didn't go quite as planned. And next, reach out for support. You can turn to the Alzheimer's Association. You can call our free 24/7 helpline to talk with master's level clinicians who can provide reliable support and information, including how to have this important conversation. And we will provide some of this information to you toward the end of the program today. Finally, see a doctor. Most people address concerns about memory, thinking, and behavior with their primary doctor, the primary care physician first. However, in some cases, your primary care physician may refer the person to a specialist for further evaluation. And examples of specialists are listed here. Geriatricians who have additional training in medical care for diseases and conditions common among older adults, generally over age 65, and neurologists who specialize in diseases of the brain and nervous system. However, please note that not all neurologists specialize in Alzheimer's or other dementias, so it's important to see someone who has that experience. There are neuropsychologists who can assess, diagnose, and treat psychological disorders associated with brain-based conditions. And of course, psychiatrists who specialize in disorders that affect mood or the way the mind actually works. Psychologists with special training in testing memory and other mental functions. And I always like to add one more to this slide, and that is pharmacologists. Sometimes they can be helpful, doctors of pharmacy who can be helpful in assessing a person's mix of medications that they may be taking, because oftentimes there are secondary or side effects of medications that could mimic symptoms of dementia or could impact someone who has dementia. So that's another resource to think about. So we now know what signs to look for and how to approach the conversation. Now we're going to talk about the benefits of early detection, but I'll stop here in case there are any questions on assessing and having that conversation.
So thank you, Jean. The one question that we have, and I don't know if this is the best time to address it, so you decide, reads, my mother had dementia for 10 years. Her autopsy showed she had Alzheimer's and Lewy body, and I wanted to know if there are any early tests that might give me insight if I will get either of the two. I do know that females are more likely to get it, and this person writes that she has 4 sisters.
We are going to, well, I'll address the second part of that question first, which is there are risk factors, and we talk about that in a separate program titled Understanding Alzheimer's and Dementia. But one risk factor for developing dementia is whether or not there is a family history. So you are at a higher risk if there is family history. The first part of your question we're going to get into here shortly, so I will defer answering that until we've covered that information. And if it's still something you're confused about, then I'll ask you to raise your hand again.
Okay, so carry on. That was our only question.
Okay,
Thanks.
great. Good questions. Okay, so
there are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So just to recap here, paying attention to changes you notice in people, especially regarding memory, thinking, or behavior, is important for early detection. If you do observe unusual behaviors or occurrences, take action by having a conversation about what you've observed. Consider using the 10 steps to approach memory concerns that we just discussed as a guide for this conversation. Customize it so that you are approaching the person in the most supportive and comfortable way possible. There are a number of benefits to early detection, such as planning for the future, access to treatments for symptoms, and participation in clinical studies. Okay, we're going to talk about seeking a diagnosis now. Let's take a look at what may be involved in the medical process to determine the cause of symptoms. So we're going to start here by testing your knowledge. And this is a true or false question. And you can enter your answer in the chat box, and then Shireen will help me see what the answers look like. So who here thinks that there is currently no way to diagnose Alzheimer's or dementia? I'll give you a few seconds here to record what you believe is the correct answer. Are we getting a mix of answers there, Shireen?
So far, we have one true.
Okay, well.
And one false. What? One false.
Okay.
Any more
others?
thoughts? Two false. Oh, falses are winning out. We've got 1, 2, 3 false. 4 false. 5 false. One
Good.
more true. Falses are leading.
Well, that's, I'm going to spoil it. Yes, you're right. It is false. Contrary to an outdated belief that an Alzheimer's diagnosis can only be made at autopsy, there are a number of assessments and tests that can make it possible for healthcare professionals to diagnose Alzheimer's and dementia with a high degree of certainty. So I hope that answers the previous question about that was asked. There are ways. You don't have to depend on an autopsy for that. That's an old myth. However, determining the cause of dementia can sometimes be more difficult. Here we're going to explore possible steps. Let's see, I'm advancing too quickly here. So here we're going to explore possible steps of the diagnostic process. I apologize for the hammering sound outside of my condominium here. There's some workers out front doing work, but hopefully it's not interrupting too much. Keep in mind as we review these steps that not everyone may be asked to undergo each one by their doctor. Well, I'm advancing too fast here. I apologize. Let me get back to my correct slide. There we go. Keep in mind as we review these steps that not everyone may be asked to undergo each of these, but assessments may include clearly a medical history, a physical exam, screening for depression, which can often mimic signs of dementia, and very importantly, interview with close companions. A number of tests may include lab tests, blood work, other kinds of testing, mental or cognitive status tests. Those are very important, especially when they're done in succession, so they compare the results from one at today and then one in 3 or 6 months later to see whether there's any change. And then brain imaging is also very important. I know my husband was unable to get MRIs, which is a very common way to look for signs of Alzheimer's and dementia, but he was able, he had a pacemaker, so you're not allowed to get an MRI if you have a pacemaker, but he was able to have a CAT scan. And when even I, as a layperson, looked at a film of that with the doctor, it was very obvious that there were places in the brain as you go down through the layers that had been impacted and destroyed. And so it was very easy to understand at that point why he was showing such symptoms. Mary's daughters are preparing for answers about their mom's changes in behavior. They wonder, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? Let's follow along. So the appointments have been going well, and Mom's been handling them okay. Her sister says, well, I think it's really dementia. And they discuss, well, I guess we won't know until we get a diagnosis. So let's ask Dr. Soloway if there could be anything else going on. Let's hear from Dr. Soloway.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So let's review. The diagnostic process will vary from person to person depending on an individual's specific situation and what the doctor feels is the right course of action for that person. The diagnosis may be something other than Alzheimer's or another dementia, which is why it's important to investigate the cause of the symptoms. Stigma and misconceptions about Alzheimer's, such as nothing can be done, or that can deter some people from seeking a diagnosis. So getting information and support is also a critical next step. Let's learn a little more about what the Alzheimer's Association offers. I'm going to break here partly because we've got some gardeners outside making a lot of noise, but I want to make sure I answered that previous question, and if there are any others, I'll entertain them now.
Hi. So the only question I believe was addressed, which are what are the ways to determine what dementia, it cut off at that point. But I think that, you know, the idea of how you tell what dementia, what type of dementia the person might have, I believe is the nature of the question.
In other words, how to determine the difference between one form of dementia versus another? Is that what I'm hearing?
That's what I understand the question to be. So does the person have Alzheimer's or vascular dementia, for instance?
Well, that's why it's so important to get to a doctor and get to the correct specialist and follow that course of action, because really it's a medical determination at that point through the series of whatever tests are appropriate for the individual. I know with my late husband, he not only had the Alzheimer's dementia, but he also was diagnosed with vascular dementia, which explained he had had a couple previous TIAs, trans-ischemic attacks, I believe is the right term for that, which were quite mild, but in the end, it was part of what led to the vascular type of dementia that he had. So the short answer is it's really a medical determination, and sometimes it's easier than others to diagnose.
Thank you. So at this point, that's the only question.
Okay. So what if the diagnosis is Alzheimer's, what's next? So let's see what Mary's daughters, Lydia and Patricia, do. They know the diagnosis is early stage Alzheimer's. They want to know what to do now. And the doctor said that the Alzheimer's Association does offer free resources. Some even help people live well with the disease. And so they're going to move on in that direction. The Alzheimer's Association is in communities across the country providing direct service to individuals and families facing the disease. The mission of the Alzheimer's Association is to eliminate Alzheimer's disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. The vision of the Alzheimer's Association is a world without Alzheimer's and all other forms of dementia. The association is available wherever and whenever you need reliable information and support. 3 of the key resources that can connect you to information and support include, very importantly, our free 24/7 helpline. You can call us at that number, 800-272-3900, anytime, day or night, to receive information and support. And this provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. This is not a typical call center. This is staffed with master's level clinicians who are available around the clock to provide in-depth care consultation, a free of charge care navigation service offered to families at any stage of the disease, and help is available in more than 200 languages. We're going to hear now from Tim, who is a care partner who has called the helpline for support. And let me just, the term care partner may be a new one for some of you versus caregiver. Care partner is simply a term that some people prefer in the very early stage of dementia when the person is still quite functional and doesn't need that much assistance or support. So care partner is a little more relevant than caregiver. So let's hear from Tim.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
I completely identify with Tim there because I did use that phone number several times. And as he said, at times it was 2 and 3 in the morning when I would wake up with almost fear or panic or anxiety about what the next day or the next week or next month was going to be like, and was I doing things correctly? And so this is a huge support, this number, and I would encourage any of you to use it for whatever reason you think is necessary. And next is our website, alz.org. This is often the first stop for individuals following a diagnosis of Alzheimer's or another dementia. It includes sections specifically for people living with the disease and their caregivers. We're going to hear from Teresa, who is living with Alzheimer's, about what questions she had and the information she found on alz.org.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And our community resource finder, another valuable service. This is a wealth of community-based resources that are available in your area, including long-term care and community-based services, local association offices, and their offerings of programs and support services. Speaking of support services, I know probably the single most helpful thing that I found through the association was a support group for care partners and caregivers. My husband joined a support group for people living with the disease in the early stage, and at the same time, I joined the separate group of the care partners, and that was just a huge value to me. And I've remained in connection with the people, most of the people in my group ever since then. We're going to hear now from Tom, who is also living with Alzheimer's, and he shares his experience seeking help from the association to find local resources.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
So now that we've taken a basic look at Alzheimer's disease and what resources are available, let's talk about how you can take action. If you're inclined and want to be involved and do something to help, we have ways to do that. So first of all, you can volunteer, whether you can spare a few hours or make a more significant time commitment. Consider volunteering with the Alzheimer's Association. There are numerous opportunities available, including becoming a community educator or joining your local walk planning committee. You can visit the website /volunteer to learn more. There is an advocacy component that we depend on members of the community to assist with. Become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. I know that from time to time, the Alzheimer's Association has a team of volunteers and staff members who make appointments and go to the state capitol to literally walk the halls of our legislature and speak with key legislators about bills that might be pending, or to influence them to reverse their position on a bill, things like that. That's a huge service that we provide to the community. There's Trial Match, which was briefly mentioned a little bit ago in this program, and that's where everyone can help advance Alzheimer's research by participating in clinical trials. You can get started with Alzheimer's Association Trial Match. It's a free and easy to use clinical studies matching service. And then our big major annual event is the Walk to End Alzheimer's. You can form or join a team for the Alzheimer's Association's Walk to End Alzheimer's and raise critical funds and awareness. Held annually in more than 600 communities nationwide, Walk to End Alzheimer's is the world's largest fundraiser for Alzheimer's care, support, and research. So you can visit our website for that as well. Okay, that concludes our program. I'm going to open it up for any questions, or if there are things that you're not clear about or things we didn't cover that you'd like to hear about. So I'll stop at this point and open it up for that question answer period.
Thank you, Jean. So please put your questions in the chat and I will read them out and share them. And I also just wanted to also remind everyone to please, if you're comfortable with this, just to support the grant funding that the Alzheimer's Association receives. Thank you to everyone who did submit their first and last name and zip code, but if you could add that in the chat, I'd be very grateful. As the Alzheimer's Association needs that to support their funding. So are there any questions in the chat?
Yes, I have a question. I'm on the phone. Can you hear me?
Yes, we can hear you.
Oh, thank you. I read somewhere about caffeine and even chocolate, dark chocolate, being good for the memory or helps. And I find personally that if I do have some dark chocolate, the pick-me-up as far as clear thinking and functioning and all the stuff that, you refer to, in a small way, of course, helps me tremendously. But I wonder if you have to have Alzheimer's or the beginning for it to be effective, or if this is just a myth. Could you refer? And I am in a study with UCSF, and on occasions when I've gone in, I've wondered if I had a cup of coffee or tea beforehand, am I cheating when, they put you through the third degree of answers and questions and stuff? Could you address that, please?
Thank you for that question. To my knowledge, there is not much research or evidence to support that particular ingredients or food is actually helpful to prevent or lessen the symptoms of Alzheimer's. I'm going to jot this down though, and that might be another question for our support line as well with some of the more experts. So I don't, I'm not avoiding the question. I just don't have the expertise myself to give a good answer to that. But like most, common remedies, I know there are many vitamins and supplements that are advertised on TV, but none of those are subjected to the same scrutiny or studies that, for example, the Food and Drug Administration would do for any medication that's approved. So there can definitely be some benefits to things like foods, coffees, chocolates that provide some stimulant to our system. I know I like coffee for the same reason. It makes me feel just a little more energetic, but I don't believe there's any evidence, but I'll follow up on that.
Thank you very much.
Thank you. And thank you for participating in a clinical trial.
Oh, yes. I even have given my brain for an autopsy at time of death, of course. So I do believe that, having perhaps enough studies with the brain after life could maybe help, a good one versus a bad one. If they've got enough brains, they could analyze a lot of things. I hope, I believe.
Absolutely. While an autopsy is not required, as we said earlier, to make the diagnosis, it's extremely helpful. I know some autopsies of the brain do point out that there were more than one dementia diagnosed, or more than one dementia present than what was diagnosed originally.
Interesting. Yes. Thank you.
Thank you. Thank you for that question. There are a few more in the chat. One is, are there typed notes for this session? And although there aren't notes, we did share the link to the Google Slides at the beginning of the chat. And before we end, I will share that again with everyone. A very specific question is this one. Is there a place where you can get an AOP4 test? Apparently, they don't think that this is given often. Do you know anything about that, Gene?
I have not heard that, no. And I don't know if Lauren, our staff partner from the association, is still on the line, if that's something she would have any information about. But again, that might be a good one for the helpline too.
Lauren, did you want to chime in? Do you have any information about that if you're still here?
Yeah, I am still here. So if you are interested in getting kind of genetic testing because of your increased risk, we recommend going through genetic counseling. Sometimes that can be included, an APO4 test can be included when you're part of a clinical trial. So hopefully that answers the question. But if you are interested in getting tested to know if you are at a higher increased risk because of your APO status, then we would encourage you to also seek some genetic counseling with that test. Thank
you, Lauren.
So, Lauren, you actually answered the second question, or perhaps part of the second question. There's a question, is there a genetic component to Alzheimer's?
So yes, genetics do play a portion of it. It's not the leading risk factor. Actually, the leading risk factor is age, which we are all doing. But it's just one of the things that plays into your risk for developing Alzheimer's or another dementia.
Thank you. I just wanted to mention that in the chat, I put the handouts of today's presentation again, so you should see it right near the end of the chat. There's a nice little link. And a person who wasn't able to join when the talk began asked if this talk will be offered again soon. So I don't know, Lauren, if you have information about when the next talk will be, or if that can be found on your website.
Absolutely. Let me put the link for the upcoming education classes into the chat.
Perfect. That's great. Thank you so much.
And I'll just add that there are two other programs that go well with this one to sort of complete what I call the triplet of programs that tell the whole story. One of them is called Understanding Alzheimer's and Dementia, and the other one is called
early.
So I'm just going to ask everyone to stay muted, and the program started at 10, which was the advertised time. So go ahead, Jean.
And then the third one is called Healthy Living for the Brain and Body. And that's a really popular one. It may seem a little repetitive in terms of things we all know about living healthy with diet, exercise, and rest and so forth. But it's a good one to look for. And I know Lauren's going to be posting the link to our class schedules. So we do repeat these programs fairly regularly.
And we've had, this is our second talk in the last few months. Of course, the library is very happy to have the Alzheimer's Association back again soon to give one of the three very popular talks. A person asks, what are the major risk factors for dementia? Can you address that?
Sure. As Lauren just mentioned, age is the greatest risk factor, but that doesn't mean that growing old automatically means you're going to get Alzheimer's. That is a myth that, you get to a certain age, you're gonna, we used to use a way outdated term called senility, which has no relevance in today's world because now we understand the anatomy and the results of the disease. Other risk factors are being a member of certain ethnic groups. For example, Hispanics have a higher rate of dementia, as do African Americans and women. Enough studies have been shown that those groups are at a higher risk. While research is still going on in those areas, some of the reasons are, again, part of living a healthy lifestyle or not having the availability of ready medical treatment or being followed regularly by a doctor, diet issues, and so forth. So the Understanding Alzheimer's program does go into greater detail about the risk factors. There are some genes that are being discovered that have what we call deterministic factors, but there's still more research needed to identify whether or not there are specific genes that can be identified that may relate to the development of the disease.
Thank you. You touched on this next question a little bit, and that is, what are some things that one can do to prevent dementia?
Well, the key, and you're giving me a good opportunity to advertise these other programs. The one called Healthy Living for Brain and Body goes into a little more detail, but essentially, in addition to diet, exercise, socialization is really important. Keeping active with something that interests you, that you can sustain over a period of time, and also challenging yourself. learning a new skill, taking a class like you're doing right now, all of those kind of things, an activity that you're particularly interested in. If it's challenging to your brain, it means that your brain is very flexible. And if you begin to show deficits in some parts of the brain, if you stay active and stay challenging your mental health, you can, in fact, get workarounds in the brain that may, if you develop dementia down the road, actually help to minimize or diminish the symptoms or the degree of the dementia. So keeping a healthy brain, which means keeping a healthy body, because the heart pumps literally 25% of the blood volume to the brain with every beat of the heart. 25% of that blood pump goes right to the brain, which is a clear indication of how important it is to our functioning. So keeping good cardiovascular health, which gets you back to good diet, exercise, and low stress and all those things. So our bodies are all interconnected.
Thank you so much. Very thorough answer and encouragement to attend the other talks. So if anyone else has a question, this would be a great time to put it in the chat. And it looks like you've answered all the questions that are there, Jean. So I just want to thank you so much for this excellent presentation. I know we all learned a lot. I want to thank everyone who attended and thank Lauren Hibden from the Alzheimer's Association again for making this possible and partnering with the library. Thank you all. And again, the program will be on our website, on the YouTube website. So with that, I think we will say goodbye and have a great day. Get out and exercise, keep our brains healthy.
Thank you, Shireen, and we appreciate the library's sponsoring of this opportunity. So good group, good questions. Thank you.
Great. Bye, everyone. Be well.
Bye, everybody.